So the morbidity and mortality due to obesity, that most of the medical professionals know, since the time of Hippocrates, which has been more than 2,500 years. So can you enumerate what are the short-term and the long-term impacts of this disease state, obesity?
Good. As recently, all of us have seen in COVID era also, the total number of deaths all over the world, all over the globe, if one calculates, it was found out that 74% of the people who had died with COVID infection, they were obese. 74%. Then if you add hypertension, if you add diabetes, 13% more. So what I mean to say, ultimately, obesity is a disease. Obesity is a disease which is not to be taken lightly today. Because, for example, you can imagine if a person is having a 40 BMI, 45 BMI, if his lungs get infection, COVID infection, then he was not able to inspire or expire or have the excellent oxygenation of the body. And that was the reason of following the PO2, and ultimately the patient had died. So many patients were put on ventilators. So our thinking is, even if, for example, in this COVID era, if you have not been able to convince yourself that this is a direct connection between obesity and death, then you will never ever learn. So our thinking is that that should go into the minds of the people, that one, the weight, second, the, as I mentioned, adiposity based chronic disease. You have the more propensity to develop diabetes. All of us know India has become the diabetic capital of the world. So many diabetics are there. Similarly, the hypertension, heart disease, cancers, and joint pains, backache, PCOD, so many comorbid conditions are associated with the disease. And can you imagine? People go in for knee transplants, right? They are obese. And once they get the knee transplants done, they think that they will start running, but they are not able to run because the basic factor was obesity. So until and unless you take care of the obesity, you will not be able to do anything for the disease which are associated with it.
Right, right. So you just mentioned about cancer. So which are the cancers which are well related to our body weights? Yeah.
Obesity has been proven beyond doubt that the chances of getting the breast, cancer endometrium, the pancreas, and so many lymphomas, so many cancers have been associated with the obesity. So ultimately, we should always think that we are not controlling the weight only, but we are controlling the aftermath of obesity also, in the form of as sinister or as the cancers are.
But then, many a times we think that we are doing everything right, eating healthy, good food, and still we are not losing a pound. So, Dr. Bhatia, is there a protocol for a healthy weight loss?
Excellent, excellent. Our thinking is that dhun badal ke dekho. Dhun badal ke dekho means all of us justify whatsoever we are taking. But ultimately, once you go to a nutritionist and then you start realizing that we were taking a lot of carbohydrates, we were taking a lot of fat, but our diet did not have much of protein. The basic requirement of a human being is 1 gram protein per kg body weight. 1 gram protein per kg body weight. And if you are especially vegetarian, then also the protein intake is very, very less. And that ultimately leads on to more of obesity. Once you change your mindset that today I am not going to take chini, chikanai, chawal, chapati, charpai, chinta, and I will be away from them, then only you will be able to push protein. Once you start taking high protein diet, then only your weight will come down. And then again, harkat mein barkat hai. Start exercising. make sure that 45 minutes or 10,000 steps or some kind of exercise is a ritual. It should become a religion. It should not be even discussed. At this age also, I get up at 4 a.m., 5 a.m. to 6 a.m. I do weightlifting, and 6:10 to 7 I do the morning walk, and then I go to
Wow.
Bala and so on and so forth. And then throughout the day, we are busy.
Correct. In fact, when you lose weight, you feel so light as if you're floating in the clouds and you get a great sense of well being. I think that's the message we should go to all our listeners. You
Tapaswini,
know,
in this context only, I would just say that many times once I do the bariatric surgery, once the people come to us, and then I ask them, what do you eat? They say, we eat compliments. Once they start losing
correct.
5 kg in first week, 3 kgs in next week, 2 kgs in next week, then they
Beautiful.
start eating compliments, and that keeps them motivated.
Wonderful. Eating to feel good. That's quite a primal human instinct. And then when we are stressed out, we crave for food which is rich in sugar and fat because that keeps us upbeat. But are there some low energy density diets that we can tell our listeners? That's what you should when you are on a weight reduction protocol.
Absolutely. One should analyze our diet so much, and we should discuss with our nutritionist also, dietitian also, that we are ultimately dependent on protein, protein, protein. For example, if you are vegetarian, then take egg white. Don't take the yellow egg, yellow part of the egg. If
Right.
you are non-vegetarian, then take the roasted chicken, roasted mutton, or but do not take the fried things. If you are a vegetarian, then take lot of cheese, milk, milk products, and pulses, so that ultimately more of protein is going within you rather than more of carbs and more of sugars and more of alcohol. As
Right. So one food which is biggest needle mover, and that's the sugar. And it's mind blowing to see the amount of sugar that which creeps in our diet. So you just mentioned about junk food. How would you really, how would you really define this word so that our youngsters get to know what exactly is this junk food?
ultimately, if one is taking high calorie food, high density calorie food, then it is a junk food. For example, if you are taking burger, if you are taking pizza or such kind of things, then it has lot of I would say carbs in it and lot of fat in it, and that is ultimately converted into the fat in the body. So try not to take these ready-made foods, as simple as that. If you are dependent on ready-made foods, then you should be ready to fall sick, fall ill early in your life, and then suffer throughout. Our thinking is as natural as possible. If you stay and take the natural salads, green salads, if you take fruits, and then you are clearly away from that junk food or the high density calorie food, then obviously you will be maintaining a great health, good health throughout your life.
Lovely, lovely. But we talked about sugars, we're talking about junk. But then a lot of people take this excuse saying that we don't eat the sugars that you say, we eat artificial sweeteners. Do you think this is correct? I mean, does it have any adverse health impacts?
Yes, definitely. Definitely, it has adverse effects. And again, we are emphasizing sugar is the ultimate killer. Sugar is the ultimate killer. Even if it is an artificial sweetener, even if it is a sweetener, it is a killer. So one should try to avoid as far as possible.
Over the counter remedies to lose weight. A lot of people opt for it. It's an easy way. But then how effective are they?
Initially, I would say that many people starting taking tablets, and
Right.
for example, Orlistat and so on and so forth. I will not name the products, but ultimately they realized that if one carries on taking or these kind of drugs or these kind of products, then in the end they start having a lot of side effects of these drugs, and these side effects can be of the range of even tendency to suicide. So our thinking is that we should not, without the prescription of a doctor, one should not take the over-the-counter drugs. One. Second thing is, lot many drugs came. Corporate also promised that this is the miracle drug which has come for obesity and which is going to change the total scenario. But after few years, because of the side effects, because of, for example, constipation, diarrhea, nausea, and so many side effects, they have been withdrawn. So our thinking is now the injectables. All of us know that injectables have come, that you take one injection every week, subcutaneous, and then it will take care of your diabetes, but it will take care of your weight loss also. But again, please do not take these injections or tablets without the prescription of a doctor. If the doctor feels that yes, you will be benefited, and for how long this drug has to be given, then only the answer is there. One. Second thing is, even if your doctor has given you this injections or tablets, but it can have only 10 to 15% weight loss, excess weight loss. Whereas with our surgery, for example, if we do sleeve gastrectomy or gastric bypass, then the weight loss is of the order of 70%. So ultimately, we should not think that we are taking the crutches, even if we are able to walk on our own feet, but we are dependent on the crutches, and then we have only 10 to 15% weight loss. And once you will leave the drugs, then it bounces back. So why be dependent on these crutches?